start with temporal. Let me think like this. Temporal, carotid, okay? Did Adam Blackaby teach you how to find it? Okay? It's between this huge muscle on the sides of your neck and your trachea, all right? The groove right in between. If you've gone to exercise aerobic classes, they usually have you find your heartbeat here. That's the carotid. We do one side at a time so that we don't cause a vagal response where their blood pressure and the heart rate lowers. All right, then we're going to, let me say next, apical heart rate. That's at the apex of the heart. We will go by our landmarks are your clavicle. So we're going to say left mid-clavicular, fifth intercostal space down. Now, you practice on yourself, on your children, because they're bonier, they have, their ribs stick out more, so you can feel the spaces in between those ribs. It should, on a normal weight person, male, it should land about on their nipple, okay? On a woman, above the nipple. On a woman, it should land on her nipple if she is of normal weight and normal size. If she is large-breasted, it will probably be below the breast. So you will take the back of your hand and lift it up and put your stethoscope on and kind of go up towards the nipple, okay? And it's different on everyone. Sometimes you just got to move around. So you've got to explain to your patient, I'm not groping you. I'm trying to find the apex of your heart. And, and everyone is different, okay? Next is brachial. It's on and I know I heard Adam saying he goes above. Yes, you can. You can feel it above the bend of your arm. It's toward the elbow side of the arm, okay? So start there. That's what you have to feel, guys, to do your blood pressures for your checkoff. You have to feel that brachial artery, put the bell of your stethoscope there, and as you inflate the cuff and that sound disappears, then you'll deflate your cuff and go 30 points past that. That's the two-step method that we have to teach y'all. You won't do it any other time, okay? Just in school. So that's the brachial. Then we'll go to radial pulse, which is on the thumb side of your wrist. Remember, I told you it's better, it's easier. If I'm doing their left wrist, I would use my right hand. Okay, use the opposite hand and go over that bone. Okay, so if I was doing, whoops, I'm coming out of your view. So if I was doing your left wrist, I'm going to use my right hand, take my fingers and go over that bone and find it. For new people that haven't practiced doing this yet, you may not want to use your pointer finger because you may feel your own pulse. So use your middle finger and your ring finger at first, okay, till you're comfortable with that. Then we have our ulnar pulse, okay, that's on the ulna bone, all right, right here. Same thing, I've done it forever, so I can use these two fingers. So radial and ulnar pulse, and then we'll go to femoral or femoral. You can say it however you want. You have to have your patient in a supine position to find it, okay? So feel around on your children this weekend, or your spouse, or yourself when you're lying in bed, so that you can find it. Then we go down to below the knee. It's on the posterior side, the back side. You have to have your knee bent. Usually best if you're in a supine position with the knee bent, and it's closer to the outside of the leg, okay? If you're going underneath here, it's going to be closer to the outside of the leg, not the inside. But everyone is different, so I can't say 100% of the time it's going to be on the outside. Okay, then we go down to the foot, the ankle area, the posterior tibialis. I know that your book shows it on the outside, but I'm telling you, as an experienced nurse who finds pulses a lot, you're going to find it better on the inside of the ankle, okay? There's a bone, there's a very prominent bone there. Go over that bone and there's a little groove, okay? And that's where you'll find the posterior tibialis. The dorsalis pedis is on the top of your foot. If this was your big toe and this was the first toe, it's right between them. Go down on the bone and go toward the pinky toe, okay, to find it. You will be expected next week when you check off. You will find these pulses, okay? Now, I'm not going to have you touching anybody's groin area to find the femoral, all right? But we want to know that you really can find it, okay? You're not just going to point to your foot. You've got to find these pulses on someone, okay? It might be like we did last week for bed baths. You check off and then you're the patient, all right? Now let's talk about vital signs, the temperatures. If I was going to do an oral temperature, I use the blue probe, okay? The red is for rectal. So I have to put a cover on this. I go underneath the tongue on either side of the frenulum. That's that little line in your, most people have that. Some have been clipped to get their temperature. I cannot, they have to close their mouth so that I can obtain an accurate temperature. If I point it towards the molars, it's the most accurate, but that gags a lot of people, especially children, so they're not going to tolerate it. So you'll probably just go right under the frenulum. But remember that you cannot take the temperature if they have just ingested caffeine, any tobacco products, and that means a dip or a cigarette. If they've had sugar-free gum or spearmint gum, okay? If they've had oral surgeries or if they're a mouth breather, okay? If they cannot breathe with their mouth shut, do not take an oral temperature, okay? You would record that as, normally we would just record it as 98.6 or whatever it is. If you don't put anything behind it, we assume it's oral, okay? Now, if I was going to do the temperature in the ear, I'm going to pull the ear back and up for an adult. That straightens out that auditory canal. And we point our probe, this little probe, we would point it forward toward the eyes, okay? If it's a child, we pull it back and down. And that, again, that straightens out the auditory canal. We record that with a T for tympanic. If I'm going to do it under the arms, that's axilla. That's the axilla, or we call it an axillary temp. So we would write it as AX. Your underarm has to be dry to do it, and you're going to put the probe under their arm, put their arm down, and point the probe towards their body. Okay? Children don't like that either because they think you're sticking them with a needle. They don't like it. So you're going to record that as AX. Rectal temp, we would place the patient on the left side in the Sims position. We're going to first, look at our anal area, clean it if we need to, inspect it for fissures or hemorrhoids, always. And the reason I have y'all do that, guys, is it's painful, okay? Things are painful. So we would use extra lubrication if they have external or internal hemorrhoids or fissures, okay? Wear gloves. I would use this red probe, put my cover on it. Like I told you before, anytime we go in any orifice of somebody's body like that, we warn them. Okay, so we're going to go in 1.5 inches on an adult. We don't have to hold the buttocks apart for them. They can tolerate it. We would record this with an R for rectal, 1 inch for a child, and just a ½ inch for an infant. And hold your probe secure and close the buttocks on the infant so that we don't, so if they squirm, this doesn't go completely in all the way. Their instinct is to push it out, okay? Sometimes they'll have a bowel movement. Some pediatricians even recommend if your child's constipated to just insert a thermometer and they'll have a bowel movement, okay? Okay, what do I want to talk about next? Respirations. Okay, so normally we do a pulse. We will count a radial pulse for 30 seconds, okay, and multiply that times 2. So if I got 40, then I'm going to multiply it times 2, and their pulse is 80, okay? I want you to also tell me about their pulse, the rhythm, and the volume. I want you to say if it was regular, so it went like this, or if it went, weird, it's irregular, okay? You don't have to tell me they're in atrial fib or whatever they're in. I just want you to know if it's regular or irregular, okay? And I want you to tell me, was it a weak, thready pulse, or did it have a good volume, okay? A strong pulse, okay? We count this for 30 seconds. The next 30 seconds, we're looking at our patient's chest. That's how we count their respirations. If they know we're counting them, they breathe funny, and they hold their breath. So they can't know, okay? So it's usually, it's generally easy to do unless they want to talk to you. So you may have to tell them, I'm trying to count your respiration, so I can't have you talk to me. Well, then they breathe funny, okay? So you might want to say, I'm counting your pulse, and do the respirations first for 30 seconds, multiply that times 2, and then do the pulse for the next 30 seconds, okay? Regular respirations should be between 12 and 20. If someone's sick, there are more. If you have a respiratory patient with COPD or emphysema, you're going to see higher rates. It might be 36, okay? And that's still really fast. But it should be between 12 and 20. So when you're practicing, I want you to know, if you're getting 30, then maybe you should let your child sit there for a few minutes. Maybe he's been running around the house or playing, and 30 is too much, okay? It should be in that normal range of 12 to 20. Okay, now let's talk about your blood pressure. So Amber, if you'll come sit up here for me, please. On the blood pressures, you're supposed to, the patient should have, you make sure they haven't ingested caffeine or tobacco in the last 30 minutes. They should be in a resting position, whether they're in the bed. You can elevate the head of their bed a little bit, or you have them sit in the chair with their legs uncrossed, okay? We generally try to, if we can, we pick the left arm, okay? And I'm going to put this cup 1 or 2 inches above the bend of her arm, okay? Above that brachial artery. And we want it to fit snug. This is a good fit for her. If she weighed 90 pounds, I need a smaller cuff, okay? I might use a pediatric cuff. If the cuff is too big for a person, it's going to give you a really low reading. Does that make sense to you? If I had a tiny little woman, it might say that her blood pressure is 70/50. That is not accurate. That means I want you to think to yourself, okay, this may not be accurate. I better go get a cuff that fits her. If she weighed over 200 pounds, I don't care if you were able to get it on this arm or not, you're going to get a higher reading, okay? So you need a cuff that fits. I'm just looking for my little thing. This fits securely here. Sometimes you can't get this to go back, so I will enlist my patient's help and say, can you hold this back for me? I think I can do it. I'm going to put this here. We want to elevate the arm. We either do this, okay, and you'll learn to do this when you get better at it, but we're supposed to have it at the level of the heart, okay? So that's why doctor's offices are generally have a table next to where the client sits, because the nurse is supposed to elevate that arm, okay? We want to get clothing out of the way, because clothing can muffle the sounds so that we can't hear it very well. Sometimes you'll have to. If they've got a really thick sweater on, you may have to have them remove it, pull their arm out of it, okay? All right, so remember I told you your ears go forward? Make sure, always listen before you put it on your patient that you can hear that loud sound, that you've got the bell turned correctly. Okay. Because this is how y'all have to check off. This is your 2-step method. You have to first locate her brachial artery, find it with your hand. I feel it really well. So I'm going to pump this up slowly until I feel that disappear. So you can stop and listen for it, or feel it with your hands. All right, it's disappeared. So I'm at 110, I know I can see it. So I'm going to go up, that was at 110. So I'm going to go up 30 past that. I'm going to wait 15 to 30 seconds to let her normal circulation return, okay? So let's pretend I waited 15 to 30 seconds. Now I'm going to go up to, now I'm going to put my stethoscope here, and I'm going to go up to 140. It is a lot easier if you have a period of silence, then you'll know exactly when that first beat hits. Does that make sense? If you have that good period of silence, you know when you hear something. So I'm going to go up to 140. It's going to be a little tight on their arm. Okay, and then I'm going to slowly release my valve. Feel it? Okay, I got 1/16/60. Okay, now if you go too slow, you're going to hear, like I said yesterday, you will hear a beat all the way down to 20 sometimes. The longer you do this, the easier it gets and the faster you can go. If I had gotten to 140 and as soon as I started releasing the valve, I heard a beat, then I need to release it completely and go up higher the next time, okay? But we do not generally pump it up to 200 on everybody, all right? Because it hurts them. And if they're on a blood thinner, especially little old ladies, if they're on a blood thinner and you squeeze their arm like that, they will have a black arm the next day, okay? And they're not happy about it. So we don't want you to do that. Now, so that's how we take our two-step. You're going to feel for the artery. You're going to pump this up until you feel that disappear, deflate it, and add 30 to that. Does that make sense? Okay. Like I said, we're supposed to teach you that two-step method. That is the correct way to do it. However, in the real world, you will not do it that way, ever. Okay? Now, if I had trouble hearing her blood pressure, let's say she's feeling really dizzy and she says she's been passing out and she comes to the doctor's office, and I try to take her blood pressure and I don't hear anything, then I'm going to palpate it. Okay? Let's say my doctor's poor and he doesn't have a Doppler. Okay? So I'm going to put my hand here on her. I'm going to find her radial pulse, if she's still got a pulse. Then I'm going to pump this up. And if I can't hear it, I'm already assuming it's kind of low, okay? So the highest I'm going to go here is like 130, all right? And then I'm going to go really slow until I hear a beat, okay? And I'm only going to be able to determine the systolic, the top number, okay? And remember what I said yesterday? Let's say I heard it at 90. Then I would write 90. Let me show you on the board. You can let that go on down. If it was palpated, I would write 90P. Okay? If I had a Doppler, I would write 90D. All right? Okay. So you'll just be asked about that, about palpation or a Doppler. If you were using a Doppler, you turn the Doppler on. It has a little silver stick. I'm sure y'all seen them. They're different for different areas. You're going to put this little gel here, the transducer gel, right there on that artery. Find it. You have to hold it with one hand while you're pumping this up with the other. Okay? Now, let's talk about postural or orthostatic hypotension. That means we feel like our patient has told us, the reason we would even do it, our patient is feeling dizzy or weak when they go to a sitting or standing position from a lying position, or they're passing out, or they feel faint. So we're going to start in the supine position with the head elevated a little bit, okay, maybe 30 degrees. And I'm going to take her heart rate, I'm going to take her pulse, and her blood pressure. Okay, let's say I got, let me write it down for myself so I don't forget. Let's say I got 130/80, and her pulse was 88, okay? Then I'm going to put her, and to do that, while she's in the bed, I'm going to elevate this arm to heart level. I can hold it myself, or I can put her arm on a pillow in the bed, okay? Then next, I don't have this on here. Next, I'm going to put her to a sitting position, where I'm going to dangle her legs off of the bed, okay? And then ask her how she feels sitting in that position. If she says, I'm feeling kind of dizzy, I'm feeling weak, I'm going to reassess her blood pressure and her pulse at this time. Let's say the blood pressure is still 130/80 and her pulse is 80. It has gone down a little bit, but not very much. So now I'm going to stand her up. But before I stand her up, because she has been weak and dizzy and passing out, I'm going to instruct her. I'm going to say, Amber, I'm going to stand you up to take your blood pressure. But if at any time you feel weak or dizzy or like you're going to pass out, I want you to just sit back on the bed. I've got you. I'm going to position myself in front of her. I'm going to make sure she has on those no-skid shoes or socks. And I'm going to position myself in front of her to do this, okay? You may even want to enlist the help of another nurse for safety. But make sure that you're in front of them so if they do start to pass out, you can push them onto the bed, okay? So for their safety. So now I'm going to stand her up. And then I'm asking her how she feels the whole time. How are you feeling? And we're going to do this pretty quickly, okay? Let's say now her blood pressure dropped to 110/70 and her pulse was 100, okay? That's positive. That's positive for postural hypotension. If the systolic goes lower than 20 points, or the diastolic more than 10, or the heart rate goes up 20, they're positive. I'll write these down for you. I'll put it on the board so you'll know the numbers, because we're going to have you walk us through the steps of this, and we're going to give you blood pressures. And so we want to know that you know what to do, okay, if it's positive or not. Let's say, let me back up and say this. Okay, so what would I do? She had a drop, okay? So I'm going to instruct her to sit back down. I'm going to lie her back down in the bed. If it had really dropped low, let's say to 80 over 50, I would put her in the Trendelenburg position. Do y'all know what that is? That's where we can, or your bed's like this, and we can lower the head like this. There's generally, most places, a button that you can push that puts the bed in Trendelenburg. If not, I would put her in flat supine, and I would lift her legs up myself, okay? Or with the help of another nurse. Now, let me go back to this. Let's say I set her up, her lying blood pressure was 130 over 80, and her pulse was 88. And I set her up, and I took it again, and it dropped to 90 over 50. Do I need to stand her up to continue this test? No. We will stop. We won't go any further. If we just set her up and she's already had that big of a drop, she will pass out when we stand her up. So do not go any further. Lie the patient back down and call the doctor. Now let me show you how we, thank you for being my patient or my, okay, this is how we chart this, okay? If he may, the doctor may say, take orthostatic blood pressures, okay? So you we do this. This is our standing, this is our sitting patient, and this is our lying patient, okay? Do you get it? I know, this is why I'm a nurse and not an artist, okay? But this is our standing person, this is sitting, and this is our lying patient, all right? I mean, y'all can draw that much better than me, I'm sure. Okay, any questions on our blood pressures? Any? Does that make sense to you about, because your instructors are going to ask you, who would need orthostatic blood pressures? Michelle, what kind of symptoms are you going to expect to have? You can go sit down, thank you. What kind of symptoms do you expect them to have that your doctor has ordered orthostatic blood pressures? That's right. Or passing out, or they've been a history of passing out. Okay, good. All right. So, any other questions about those? Now we're just going to practice. Yes, Lee.
Is it more important if the systolic or the diastolic?
The systolic drop on the drop.
Yeah.
The systolic. Okay, definitely. Thanks for asking that. That's a good question. And it has to, it's positive if it drops 20 points, okay? Okay, let me throw this at you. Let's say their blood pressure was 130 over 80 lying. It was 120 over 80 sitting, and the pulse was the same. And then you stand them up, and the pulse goes to 140. Do we have a positive or not? But the blood pressure doesn't drop. It's still positive, guys, okay? Because their pulse went sky high. So either one of those, if the blood pressure changes or their pulse increases, something's going on with your patient, okay? So I'll write those. They're also in your book, okay? At the end of your chapter, every one of those are in your book. But I'll write it on the board so that you know that, because you will be asked those questions, okay? All right, that's it.